It's the beginning of another work week. Let's remind you that we all have an important role to play in stopping the spread of COVID-19. We encourage you to take the necessary precautions to protect yourselves and families by always wearing a mask, practicing social distancing, and washing or sanitizing your hands frequently. Welcome to InfoHub for Monday, August 31. Thank you for joining us as we continue to highlight the work of the PPC administration aimed at improving the quality of life of all Guyanese. His Excellency Dr. Mohamed Irfan Ali, President of the Cooperative Republic of Guyana, says the Guyana Defense Force will soon become more community-oriented. The announcement comes on the heels of the promotion of 5 officers of the GDF at State House today.
The promotions of the officer, the President said, was long overdue and are necessary to strengthen the leadership of the GDF. However, the President said the Defense Boards commenced discussions on a strategic way forward on how the military will become integrated in the community life.
Guyanese must not only see these distinguished men and women in uniform as just members of the Army. They must see you as a key and integral part of their development, of their community development, and of our national development.
The GDF, the President pointed out, has men and women with tremendous skill sets and experience.
The time has come for us to harness this great potential in our military to uplift and build communities all across our country. And this will be the focus, to make the military more community-oriented, community-engaged, and more in line with the national development trusts of our country.
President Dr. Ali urged the GDF to think outside the box as a course is chartered in which the military will be actively involved in the development, shift, and advancement of our country.
Especially under the changing conditions. A new oil and gas sector emerging, new security challenges, new border challenges. The military has to and will and must play a key role in the emerging needs of our country.
Receiving promotions were Colonel Gary Beaton, who was promoted to Substantive Colonel effective January 1, 2016, and to Substantive Brigadier effective from August 28, 2020. Lieutenant Colonels Ronald Hercules, Julius Skeet, Omar Khan, and Ken Lloyd Roberts were promoted to the rank of Substantive Colonel. The ranks also received the Military Service Medal for distinctive service beyond the call of duty. Isaiah Braffett for InfoHub.
Tiger Bay Georgetown residents are beneficiaries of 150 relief hampers. The initiative was a collaborative effort of His Excellency Dr. Mohamed Irfan Ali, President of the Cooperative Republic of Guyana, First Lady, Her Excellency Arya Ali, civil society groups, the Muslim Youth Organization, People's Beauty Products, and a number of other businesses.
President Ali expressed his gratitude to the organizations for their generous donations to the Tiger Bay residents.
I want to say to them that this is a strong signal of their love for community, their love for society, and this is the type of example we want in our country, where when we start looking at each other as each other brothers and sisters keeper, when we start looking at each other to make each other, to be a better neighbor to each other, then block by block we'll be able to break down a number of the hindrances to the development of our societies.
During his walkabout, President Ali firmly stated that under his administration, there will be no gaps between the government and the people. His Excellency further noted that part of the People's Progressive Party Civic's role as the new government is to create a number of programs with emphasis on community empowerment and development, especially in the vulnerable communities.
If we can get the young people from these communities, train them to do carpentry, train them to do construction, so that we can help create jobs, create small groups of people. We want to bring people into groups, give them the capacity, help them with small financing. So not only will they be workers, but they can own small businesses to help in building some of these government homes. So what you will see over the next month, especially, is a strong team-oriented approach with the police, with the private sector, with government, and with youth, the people in the community. So to try to get solutions that are community-based and solutions that are long-lasting.
The president assured the residents that his government will work closely with all communities, regardless of their political affiliations.
The government is ready to work with you. There must be no fear that the government is separate from you, or the government is only elected for PPP supporters. No, that is not it. The government is here for all of us, all of you.
President Ali reminded residents of the gravity of COVID-19. While he expressed his dismay for Guyanese not adhering to all the health protocols, he reminded them of the importance of wearing face masks at all times to curtail the spread of the COVID-19. For InfoHub, Gavin Lewis.
The world saw Mingo attempted to destroy democracy in Guyana. Those were the sentiments expressed by Attorney General and Minister of Legal Affairs, the Honorable Mohabir Anil Nandlal, as he weighed in on the investigations into electoral fraud.
The Attorney General said District 4 Returning Officer Mr. Claremont Mingo attempted to destroy democracy and disenfranchise thousands of voters at the March 2 elections. He has thus far been slapped with 4 charges of electoral fraud. Mingo's arrest has led to unrest in Belgium on the west coast of Berbice. However, the Attorney General is of the view that the actions of the protesters are not only unlawful but have no basis.
The whole world saw that Mr. Mingo attempted to deny tens of thousands of people their votes. The world saw that Mingo attempted to destroy this democracy in this country, that Mingo played a role in causing Guyana to come to near destruction.
AG Nandalal noted that the local and international communities, along with Guyana's legal system, demand that Mr. Mingo is made to face the law.
And the law is being applied, and Mr. Mingo is being detained, and the investigations into his conduct are ongoing. There is absolutely nothing wrong with that. That is what is expected in a civilized democratic country.
Minister Ben has described the protest action as very unfortunate and unnecessary. He also underscored that it is also unlawful.
And I want to ask those persons who are involved in the protest to return to peaceful protests if they feel that protesting is necessary, not to block the public roads, not to inconvenience people, not to attack the police, not to bring it to a situation where the police have to resort to tear gas or the firing of pellets. We don't want people injured. We don't want people inconvenienced. People have a right to protest, but it must be done in a lawful way, and it should not inconvenience the public.
The Home Affairs Minister said the Guyana Police Force has shown a lot of restraint in the face of the violent protests, which indicate the force can properly handle the situation. Isaiah Braffett for InfoHub.
Turning our attention to the health sector, the Caribbean Public Health Agency, CARFA, in collaboration with the CARICOM Implementation Agency for Crime and Security and the British High Commission, donated medical supplies to the Materials Management Unit and the Guyana Prison Service to support Guyana's fight against the COVID-19 pandemic. The handover took place today at the Eugene F. Correa International Airport.
Director of the Guyana Prison Service, Gladwin Samuels, noted that the main medical supplies will be distributed to the Georgetown, Lusignan, and New Amsterdam prisons, while items such as face masks and gloves will be dispersed to other prison locations.
Today is Guyana Day, the day that we have received our donations, and those items will go a far way to aid the prison service in keeping the coronavirus out of the prisons. We have been doing quite well so far with resources provided by the government and businesses across Guyana, and with the donations we've received today, we see it going a further way in terms of the fight.
Head of Medical Department of the Guyana Prison Service, Dr. Kwesi Sinclair, deemed the donation as timely.
This agency would have been able today to donate primarily to the medical department of the Guyana Prison Service a quantity of personal protective equipment, but more so advanced medical items, which include patient cardiac monitors, defibrillators, nebulizers, etc., to help basically everyone involved in the Guyana Prison Service, whether you're an inmate and officer, as we fight against not only coronavirus, but any chronic illness that we have to encounter within our population.
During an interview with DPI, Minister of Health, Honorable Dr. Frank Anthony, disclosed that the flight which delivered the medical donations will be carrying out 500 test samples to the Caribbean Public Health Agency.
Most of the items that we're receiving, they're coming through CARFA, that's the Caribbean Public Health Agency, and they have received donations from several international organizations. So CARFA has been coordinating this distribution to all the Caribbean territories. It would come to the central stores, and at the material management unit that we have at Diamond, it will go there. We have a special section that we have established for COVID-19 supplies, so it will go into that specific area.
For InfoHub, Gavin Lewis.
Meanwhile, Minister of Health, the Honorable Dr. Frank Anthony, is optimistic that the COVID-19 hospital will be ready by this week. The minister made the pronouncement following a guided tour of the Center for Disease Control and Prevention.
The tour was led by the Georgetown Public Hospital Corporation's Director of Medical and Professional Services, Dr. Facette Jeffrey. Dr. Anthony explained that the biggest challenge faced has been ensuring stable electricity throughout the building. The Health Ministry, Guyana Power and Light Incorporated, and a minister within the Ministry of Public Works, Honorable Deodat Indar, collaborated in order to power up the main grid feeding the facility. The health minister also relayed that a second challenge, water availability, is being addressed with the Guyana Water Incorporated.
They have agreed in the interim, once we have patients here, in the interim, every day, they would be bringing water to the facility to ensure that we have adequate water supply. In the meantime, we'll resolve the technical issues. It will probably take maybe a week to resolve those technical issues with the water. And then we'll go to the normal GWI water system.
This facility, which currently holds 197 beds, will allow 50% usage during Phase 1, thus removing the burden from GPHC, allowing them to cater for more severe cases and non-COVID-19 patients.
The facility for this phase has 55 beds upstairs, 42 beds downstairs. We recognize from the numbers we have at the Georgetown Hospital that we can transfer. We're going to probably be putting somewhere in the vicinity of 30 patients or 40 patients in the area downstairs already. Right now the hospital is compressed so that we can accommodate the COVID-19 patients. As soon as we get this facility up and running, we can now try to move the patients over. So that may be another probably 20 patients, because on average every day we notice 20-something patients who are in our transition unit. So when we can bring those transition unit patients here, it will allow me to free up the Georgetown Hospital to accommodate the non-COVID patients in a better way.
Dr. Jeffrey disclosed that while the Health Ministry and the Cuban Medical Brigade have assisted the GPHC with doctors and nurses, he is calling on the other institutions to join forces with the GPHC.
We have appealed and continue appealing to the other institutions. If they have extra nurses that they can loan us, we would be really happy, because it will help us to care for the patients even better.
Dr. Anthony disclosed that the COVID-19 hospital has adequate medical staff to cater for the incoming patients. He also expressed his sincere gratitude for contractors, the GPHC, and other agencies that have recognized the gravity of COVID-19 and are working to ensure the facility is suitably furnished to house patients.
From the Ministry of Health perspective, we think that all these agencies recognize that, the emergency and the urgency that we are facing, in terms of ensuring that we have this facility ready for our patients, and they've gone that extra mile to ensure that they work closely with us for this facility to be up and ready. So we are extremely grateful for the cooperation.
For InfoHub, Gavin Lewis.
More news after this short break. Stay with us. Welcome back. Still in the health sector. The Inter-American Development Bank has once again delivered on its commitment to Guyana through a loan to improve maternal and child health services, particularly in regions 3, 4, and 9.
The items handed over on Saturday worth approximately $5 million. They include beds, pediatric cots, examination lamps, and trolleys.
As you know, maternal and child health is one of the priorities of the government. And we would want to ensure that our mothers are safe, that babies are safe. This project was conceived to ensure that 3 of our regions have the adequate facilities that they need to have safe deliveries. And of course, the environment in which our mothers are kept, that we enhance the environment. So as you heard, the project specifically targets Region 3, Region 2 and Region 7, and that is because the assessments that were done to be able to develop the project has pointed out to the needs in these regions. This is just the first part of what we are doing, and we are happy that not only did the beds come, but you have started to utilize them.
Minister of Health, Honorable Dr. Frank Anthony. The Inter-American Development Bank in 2016 approved a US $8 million loan for a program to help reduce maternal, perinatal, and neonatal deaths in Guyana. The handing over of the items is a result of this loan. Minister Anthony indicated his interest in having the hospital's neonatal intensive care unit up and running once more.
We believe that we can have that area refurbished, remove those material that has been infested with the fungus and mold, and perhaps being able to sort that whole area out. And that is one of the things that I'll ask the project that we have currently to perhaps pay some attention to see whether we will be able to remodel that area.
Added to this, the minister hinted that by late 2020 to early 2021, the capital project to rebuild major section of the hospital will come on stream. This will be through collaboration and a loan from the Indian Exim Bank. Dr. Anthony also took the opportunity to inform the staff that in the interim, the Ministry of Health will be working closely with the Regional Democratic Council to rectify a number of issues which had been identified at the West Demerara Regional Hospital. Kellen Rover for InfoHub.
Great news for pensioners. Minister of Human Services and Social Security, the Honorable Dr. Vindhya Prasad, during a virtual press conference, discussed areas that her ministry will focus on. Amongst the issues discussed were payment systems for pensioners.
A number of systems are in place, and a number of systems that are in place or that would have been started from earlier this year will continue, but we are adding on a few more initiatives to make delivery better and to ensure that we have less congestion at the already recognized places of delivery.
Minister Prasad highlighted that there are approximately 59,406 pensioners under the ministry's pension payroll. She noted that the ministry will be working on the direct payment system to encourage persons to utilize the banking system where it can be deposited in the bank accounts of the pensioners.
Now, this is a voluntary system, so I hope you will help us to encourage pensioners to sign up for this. In other words, they have to do no lining up whatsoever. And pensioners who are over 65 and they receive government pension from the Ministry of Finance, we encourage them to sign up for direct transition to the bank payment system.
The ministry will be starting a new initiative in September, which is direct delivery.
Direct delivery and payment to 3,400 shut-in pensioners. This means people who have disabilities, who are bedridden.
Minister Prasad explained that the ministry will be having a phased approach to alternative venues.
That would include places like MoneyGram, Western Union. So the post office is not the only venue that pensioners will have to go to, because we are conscious that the post office may not be convenient, may not be close, and also may be a site or a hub for crowding and congestion. So we are looking at these alternate venues, which will be established venues for long-term accessibility to pension.
The minister also informed of a partnership with the local government ministry to ensure a more efficient pension payment system regionally.
In that, more sites will pop up, more persons are out there who can deliver through an already existing regional system. And we feel that this will be extremely beneficial for people in remote areas. In fact, there is a direct payment system that has started in the hinterland, Region 9 in particular. And what we plan to do, since this system is working quite well, we plan to increase the number of areas where direct payments will be made.
Minister Prasad also said that the abbreviated payment system, which started sometime in April, will continue, where there is an alphabetized system and early payment measures.
In other words, pensioners can access their monies earlier than the first of the month, and the 5-day payment system that usually begins this period, it's in an alphabetized way.
The minister said the 3 months validity period will be waived.
This means that pensioners who were not able to receive their pension from as far as January can now do so without having to come for us to verify them or to do anything at the level of the ministry.
For InfoHub, I am Kellon Rover.
The Ministry of Housing and Water this morning announced the appointment of Mr. Sheikh Bashk as the new Chief Executive Officer of the Guyana Water Incorporated, GWI. Mr. Bashk brings with him a wealth of knowledge, having served in the sector for a number of years. He held the post of Minister of Housing and Water from 1998 to 2006. He also served in the capacity of CEO at the Guyana Water Incorporated from 2012 to 2015. Mr. Bashk holds a bachelor's degree in management from the University of Guyana and an MSc in management from the University of London. He also served as a lecturer at the University of Guyana and as an executive in the private sector. Join us tomorrow for live coverage of the opening of the 12th Parliament at the Arthur Chong Conference Centre from 10 hours. Members of Parliament, the Speaker and Deputy Speaker are expected to be sworn in. The budgets for constitutional agencies will also be presented. Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including Facebook, YouTube, and Instagram, and visit our website, dpi.gov.gy, as we bring you the latest and important news on what the government is doing to ensure the continued development of our country. Your Bridge reports are up next. Goodbye for now.